And you have sent me some extraordinary... Check this out, folks. If you're watching on YouTube, we'll show you these documents, but if you're not, I'll read some of the contents. It's just unbelievable. You've sent me posters, instruction sheets, stickers that have been sent to you and other all GPs, NHS GPs around the country. The essence is it's all about kind of breast cancer. But of course, it is headlined, ready folks? The importance of checking your, drumroll, chest. Not breasts. It includes this instruction to GPs. These are doctors, you know, not stupid people, I would hazard a guess. I mean, Renee's a bit stupid, but mainly... No, that's a joke. Seriously. It goes like this. People of all ages, this is to doctors, not to sort of school kids or anything like this. From the NHS, people of all ages and genders can get breast cancer. Guys, gals, and non-binary pals. It goes on to say, the word chest is inclusive of all bodies and genders. When we need to be clinically accurate, of course, though, we use the word breast. Well, since when was it the habit of doctors and GPs to be clinically inaccurate? What benefit is it could you bring to your patients by being clinically inaccurate?
None. And I can promise you, having trained as a doctor, that if somebody said to me in one of my exams, Renee, would you examine Kevin's chest? I would listen to your lungs and your heart, because that's what a chest exam is. Never have I said to the woman, come on, let's examine your chest. I say, I'm going to examine your breast, is that okay?
It's so ridiculous.
But even worse, the headline of this, and this is to give to patients, is copper feel.
Copper feel?
Copper feel. As in, hey, copper feel of this.
Yeah.
So they're sexualising it and then calling it a chest.
In a rather puerile way.
In a really puerile way.
We're talking about breast cancer here.
Yeah.
You know, it's like... So, in essence, the NHS is saying, you know, tell your patients, you know, copper feel.
Copper feel. And, you know, the NHS, these are actually made by a charity that works with Cosmopolitan supplying into NHS GPs. You know, they've already been told that we must use proper language now. And actually, it'd be really easy. Some men do get breast cancer. One of my best friends died of it, a man. So it's really easy. You say, listen, check your breasts for lumps, and don't forget, guys, you can get breast cancer too. Yeah. I mean, it's as easy as that.
I was saying this, we were having a discussion in the office about this earlier. I mean, you know, OK, they're not prominent, but men do have breasts,
yes.
don't they?
Yes, of course.
So a chest we take to mean underneath the skin,
heart and lungs.
Or you're coughing or something like that. So it's inaccurate. So the NHS is telling GPs to talk to their patients.
Well, it's a supplier to the NHS.
Yeah, to talk to their patients and use the term chest because that's inclusive. But if you want to be accurate, use the term breasts.
Because that's what they are. I mean, every day I wake up and I believe and hope that this is over, this craziness. And then every day, I was so mad when I saw this. It was new. I went into reception and our receptionists were really excited by their stickers. I'm like, what is that? And then I started reading it and I was absolutely horrified.
Unbelievable, unbelievable. Yeah, well, folks, if you got the don't forget, call Dr. Renee with any of your medical problems, anything you like. Give her a call. As I say, a lot of people have problems with the NHS. You might not be unhappy with the treatment you're getting. She's very good at this, so give her a call, 0344499 1000. But
talking about breasts,
yes, you wanted to highlight. Well, go on.
There's a little bit more madness this week. So Baroness Nicholas of Winterbourne has written to the Charity Commission about the La Leche League of Great Britain. Now, this is a charity that was set up decades ago to help women. Their aim actually is to promote the physical and psychological health of mothers and children through education in the technique of breastfeeding.
Right.
It's about breastfeeding. However, recently the founder of that very charity, Marion Thompson, has resigned as a director because they have decided that they will include in their classes and anything that they supply to women who could be described as vulnerable having just given birth, men. And they will teach men
how to breastfeed.
to be inclusive.
That would be actually, you know, you're knocking this, but that could be very useful to me, because I'm a bloke. I really will need to do a lot of chest feeding in my life. What is this madness?
We see this is where the two link together.
This is how trans women can pretend to breastfeed.
Yeah.
Is that the idea?
Can take drugs to try and produce milk and satisfy their fetish to have a baby suckle at their nipple, because that's what it is. And the Baroness's letter is so brilliant. She talks about them breaking the Equality Act, but then she goes on to say that forcing a child to ingest a cocktail of chemicals from the chest of a male is not merely grossly unnatural, it is unhealthy. Then she says it is true that the BBC, you're like this, once managed to find an obscure academic who asserted that this excretion was healthy. She then says...
we're laughing. If you didn't laugh, you'd cry.
We're laughing because it's so brilliant. She then says that to say that this milk is healthy is comparable in the way that a sewer is comparable to a mountain stream.
Yeah. I mean, it's just unbelievable. And you know, I know this isn't directly to do with the NHS, but... this is the sort of nonsense, because this prevails in the NHS. Don't forget, folks, many of you may have experienced this. Many of you, you know, these kind of people that technically you call blokes, like me, when you go for an X-ray in the NHS, everyone, including men, have to be asked, you know, are you pregnant?
Yeah.
And that, you know, it's a wise question to all women, because, of course, X-ray rays can affect an unborn fetus. But because of, you know, the trans issues, you know, because of trans, you know, being nice to trans people, all people have to be asked that. So if I go for an X-ray, the poor doctors and the poor nurses have to ask me if I'm pregnant. I always say this. I haven't been for an X-ray for a long time. But if I ever do get in that situation, they say, are you pregnant? I'm just going to say, take a wild guess.
Do you know what you should say?
Yeah.
You should say yes. And let them deal with it. Watch them
Yes,
melt
8
down.
months.
Yeah.
I'm looking forward to the happy day. Can't you tell?
Yeah, and let them deal with it. That's what I think men should do.
Yeah.
But what's interesting about this, these are all charities that NHS doctors will recommend that their patients use. And if you think about the last one, Copper Feel, Examine Your Chest, they're all coming in line with each other, because the moment that you call breasts a chest, you then can quite easily slip to chest feeding from breastfeeding.
Yeah.
And they're all just syncing together to try and eradicate any words, once again, that are unique to something that a woman alone can do.
Now, in terms of the NHS, you're talking about a charity there, and these leaflets that we were talking about earlier that you've been sent are not technically the fault of the NHS, but they are part of the whole kind of cornucopia of nonsense that seems to be infecting the medical arena right now. But the NHS is the epicentre of all this. We know about huge NHS pamphlets about motherhood that never once mentioned the word woman or mother, etc., etc., etc. Now, this literature, this culture infests the NHS. Yeah. It costs a lot of money. It gets in the way of accurate clinical medical treatment. Now, you know, Wes Streeting, our dynamic new health secretary, I'm going to solve the problems of the NHS.
Without giving them any money unless they reform.
Yeah, well, he's already done that, hasn't he? Yeah, they won't get any money until they reform. Oh, all right then, 11 billion. Well, this is what he should get to grips with.
Yeah, absolutely. 100%. They should stop overnight. As we've said before, the moment you start reducing a woman to her body parts, 48% of women don't know what their cervix is. So when we call them for a cervical screen, instead of, you know, instead of saying women come from, when we just say people with a cervix, we risk missing 48% of people. It's dangerous.
Yeah, when we started referring to people with cervixes, a lot of women
don't know.
Didn't realise they even had cervixes. They thought, you know, so the number of... When the NHS started referring to women as people with cervixes, the number of women who went for cancer tests, smear tests, plummeted. So this is dangerous. And you were telling me the other week, Renee, that there are conditions, you know, for example, that are only affect people of colour, people from Asian areas or the Mediterranean
or
areas,
mainly,
and you're not allowed to point that out.
Yeah.
You know, so this wokery, this political correctness is harming people. It's affecting the NHS's ability to treat patients properly, right?
Yeah. Absolutely. And we need to just stop now. We need to go back to the fact that there are only two sexes and therefore genders. Yeah. There are men and women, female and male.
Yeah, I say there are two sexes, male and female, and there are two genders, male and female. That's it. That's it. You know, people say, well, there's a difference between gender and sex. Well, if you're using the word sex in terms of denoting, you know, whether or not you're male or female, that makes the word sex the same as gender, basically. Yeah. So this nonsense about, to say sex and gender are different words, when denoting male or female, they're not. So you can't have 107 genders or 150 genders. The number seems to change every time.
I mean, the madness of it was, I heard somebody say to me in the week, my son's got a girlfriend who's non-binary. I was like, how are they a girlfriend if they're non-binary? Hang on a minute. I'm really confused.
Well, I mean, what even is non-binary? Is it like they don't want to be called a bloke or a girl?
So how are they a girlfriend?
Yeah, but that's the idea, isn't it?
It is, but also...
But they want to be a girl, but don't call them a girl.
Well, I don't know. But the thing is...
Can I meet them so I can call them a girl?
Surely the clue is in the word binary. It means two.
Yeah.
Male or female.
It's just, look, if stupid kids want to play around with this nonsense, fine. You know, if woke idiots want to play around with it, go ahead. But we really must not let this insanity infect the NHS. And when I say that, that is in the full knowledge, and you'll agree with this, Renee, that it has infected, it has poisoned the NHS.
I was going to say it's worse than that.
It's poisoned the NHS.
Yeah, and it's bringing it close to terminal now.
Yeah, so West Streeting, get to grips with that. There's a lot of other things to get to grips with. You know, maybe get rid of the 3,500 non-medically qualified middle managers who earn more than £100,000 a year. Many of them are up around £300,000 a year, doing jobs nobody can explain. Oh, they haven't got enough money. Well, get rid of that lot then. Give it to the nurses, give it to the doctors, buy some equipment. You know, it's just crazy, isn't it?
It's insane. Literally insane.
It is very insane. Listen, folks, if you've got any feelings about what we've been talking about, chest feeding, chests, not
copping
breasts, copping a feel, this nonsense, this wokery, you know, are you pregnant? Of course I'm not pregnant, I'm a bloke. You know, you're a doctor. Why are you asking me if I'm pregnant?
I think all men...
You're a nurse. Don't be ridiculous.
All men now, when asked if they're pregnant, should say yes.
Yeah, that's what I'm going to do, yeah. 8.5 months, very soon. Looking forward to the nappy day. Seriously. When we come back, it is your calls, but if you want to call us about that, let's have a chat about the wokery that, in my view, is actually destroying the NHS. It's certainly poisoning the NHS. If you want to have a political chat with me and Renee, by all means, but mainly call Dr. Renee with your medical problems, 0344 499 1000, and we'll open the surgery after these messages. Welcome back. As you know, the surgery is open. It's Dr. Renee. Call Dr. Renee Hoenderkamp. She's in the studio to answer all your medical problems. And if you like, you can send in a text or a WhatsApp message, 03444 499 1000, and we'll try and get to those as well. But mainly it's best if you call. The lines are open. Let's first of all go to Hampshire and talk to Roy. Hello, Roy. Speak to Dr. Renee. I've got one word in my notes on you. It's an intriguing one. It says sticky.
Yeah, I went to the chemist today because I had sticky eyes.
Okay. I wonder what it was. Thank God it was your eyes. I was a bit worried there. Okay, so talk to Dr. Renee. Yeah.
Hello.
Yes. So instead of going to the doctors, I went to the chemist.
Good.
And she gave me some drops.
Good.
And they cost me a tenner. Well,
right.
£9.80.
Do you know what they are?
No, well, I'll put them in the fridge. They've got to stay in the fridge.
So they're chloramphenicol?
Yes. But if I'd have gone to the doctors, he'd have given me a prescription
Yeah.
and I wouldn't have had to pay for them. So why can't there be some system in the chemist that if you're an old age pensioner and you don't pay for prescriptions, you get them for free?
What a good... Yeah, absolutely. Why isn't there that system? That's ridiculous.
So, to be fair, to reverse this, we try to tell people that for common everyday things like conjunctivitis, eczema, ingrained toenails, things like that, not ingrained toenails, sorry, athlete's foot, thrush for women, they should go to the chemist and buy it. So we try and push people that way anyway, not only to save on appointment times, but also to save on the budget of the NHS. So we do try and make people buy simple things that they can treat themselves with over the counter. I do get what you're saying, but also we are prescribing millions of things every day that are quite simple over-the-counter fixes.
Yeah. Yeah, but the only thing, £10 this time of the year is the money for me.
I know.
Did you, Roy? Did you have to go? Did you go to the chemist because you couldn't quite get to see your GP? Was that?
No, I thought this time of the year the doctors are busy. I mean, they keep telling you go to your chemist.
Yeah.
Don't go to hospital.
How long have your eyes? How long have your eyes been sticky for, Roy?
Best part of a week.
Okay, because usually after about 5 days it will get better on its own anyway. But if it's been a week, we would have prescribed for you. You're right.
Yeah. No, it's just a...
No, it's a good thought, Roy.
I think it's a good thought too. Maybe just for people over the age of 65, when they would have got free prescriptions anyway, there should be a system.
You're totally right. I think the chemist should be cut in, and if you're a pensioner, you don't have to pay, and the government pays the chemist. Sound good to me, Roy. Sorry you had to pay that. Really good call, though. Really interesting, and good luck with your eyes. All the best, Roy. Now, let's go to... We got time? Hang on. Yeah, we got time, haven't we? Yeah, so I'm lost.
He's asleep.
Let's go to Heather in Dorset. Hello, Heather. Talk to Dr. Renee.
Hi, Heather. How can I help?
Oh, hi to you both. I love listening to you both. You're brilliant.
Oh,
thank you,
Thank
Heather.
you. There's two subjects. I wonder which you could help best on. One is rights of birthing in having a water birth in hospital.
Right.
Or the other, much as my daughter. And the other is me dealing with chronic pain when my GPs are wanting to reduce my medication.
Let's do your chronic pain first. Why have you got chronic pain, Heather?
Okay, so I had lots of accidents 28 years ago. I had a car accident and caving accident, cracked some ribs, nearly fell off a cliff. Just the normal things.
9 lives then.
Yeah. And what, you sort of broke bones and pulled muscles, and you're left with a lot of pain, yeah?
Yeah, I developed fibromyalgia. I've been through the chronic pain rehabilitation back in '99. I've gone through the pain clinics, and they've got fantastic advice. So all the things they can teach me, relaxation, using oils, homeopathic remedies, meditation, mindfulness, all of that, I practice. I try to stay stress-free. So I do all that.
How old are you?
48.
Okay.
I've had different medications and reacted badly to them, like amitriptyline. I had a seizure.
Yeah.
Tegretol, I passed out. Pregabalin for the nerve pain, because I also have trigeminal neuralgia and neuralgia in my arm and leg from the accidents.
So Heather, why are they cutting back on your painkillers?
I don't know. She said what we need to try to do, because I take tramadol slow release, and that helps sort of dampen down the peaks of pain. But the pain peaks during the day when I need to have a shower, when I need to get dressed, go to the toilet. Through the night, I wake up with a lot of muscle spasms and pain, and it's horrendous. So when it peaks, that's when I take Oromorph, and I'll take 8.5 to 10 mils of the Oromorph. And they've been reducing it, and having a significant impact on my ability to even... If I wake up in pain and I need to take the Oromorph, I have to sit in my bed before I can even get to the toilet because the pain is that bad.
I'm sorry. Look, it's a very difficult one to answer.
What to do.
I mean, look, they're probably trying to reduce it because of the addictive nature of morphine, Oromorph. And it is addictive, and obviously it's a respiratory depressant as well, so there are risks involved. There's constipation with it. I know. Also, most of the evidence says that if you've been on long-term painkillers for any significant amount of time, they're not doing anything anymore because of the way the brain and pain works. It's very, very difficult. The only thing I'd say at your age is the thing that might be exacerbating the pain and making it worse, and certainly not allowing you to get through this difficult time, is menopause and perimenopause.
Well, I've actually had a hysterectomy at 28 due to endometriosis.
Interesting. And did they give you
HRT gel? Yeah, I knew you was going to ask. I heard you saying about that the other day. And I've also got, because I know your question about the Sanvena gel's not always that good at absorbing, but I have to have that because I've got anti-phospholipid antibodies.
No, that's fine, but there are other ways of having it. There's Lenzetto spray, there's patches. What you want to do is get your GP to do a blood test to look at your estradiol and make sure your level is over 300, because if it's under that, it won't be doing anything. So why don't you try that, because that might help you cope with this as they try and change it. But speak to them as well, because you're clearly very distressed.
I said to her, it's like, as you get older, you need more pain, more tablets usually for different things. And I'm like, what is my life for if I'm just resting, waiting, because I might need heart medicine or blood pressure medicine as I get older? And I'm like, I'm not taking the medicine so I can do vast amount of exercise or anything.
But maybe exercise would help as well.
Well, I do have exercise. I'm going through physio at the moment from a knee injury I had a few years ago.
God, blimey, you've been in the wars, Heather. Listen, take Dr. Renee's advice. Just before you go, we haven't got long, but you wanted to ask about your daughter wanting a water birth. What's the question there?
So basically, she had to have a caesarean the first time. The second time, she fought for it and got a water birth, and that was non-medical intervention. This time they said because her booking in weight made her BMI 40.5, they won't let her have one. Although she's lost 2 stone, she's now 17 stone something, and she's 5'8.5", 5'10". But surely it goes on what weight you are at the time. They're saying because we might not be able to get you out of the pool.
Has she lost that weight during the pregnancy?
She has.
Good for her.
With both of her pregnancies.
Good for her. People often think it's bad to lose weight in pregnancy, but it isn't. Not if you're overweight to start with.
To her.
Yeah. So look, it's very difficult because it sounds to me like they're basing that decision on whether or not they could get her out quickly should something go wrong.
That's what they said, yeah.
So I think she has to weigh up the risk of that, because you do never know, and things go wrong quickly in obstetrics. I've done that job. They go wrong quickly, and you would want her out of that pool if it was going wrong.
I mean, her husband and her, they're both farmers. He can lift her, no problem. If there was, she's like, if you're saying that's because you can't lift me, what if I was to collapse on the floor?
But they could still treat her on the floor. They could treat her on the floor, yeah. Listen, Heather, good luck.
Thank you.
Good luck with both of those things.
All right, Heather, if you want to call again every Thursday, you're always welcome. There's Heather. Blimey. Poor lady.
Chronic pain is probably one of the most difficult things.
Well, on a much more minor scale, I can sympathise with that because I've had some tooth problems, rather famous tooth problems. And this week I've been really bad toothache, and you wake up, and it's raging, and you have to take painkillers, and then you have to sort of lie there and wait until they work. And in the meantime, you're going, my God, so, I'm nothing like Heather, but I can really sympathise. That situation where you wake up in the middle of the night and the pain is unbearable, and you have to wait for the painkillers to work. And if you haven't got enough painkillers, it's just misery itself. So our sympathy to Heather there. We're going to go to break now. When we come back, Karen in Malaga in Spain. Stay where you are. We'll be with you in a moment. We're back. Right, it's still call Dr. Renee. Give Dr. Renee Hoenderkamp a call with any of your medical problems. 03444 99 1000. And before the break, I promised that we'd go to Malaga in Spain and talk to Karen, who suffers from insomnia. I feel your pain, Karen. Talk to Dr. Renee.
Hello, Karen.
Okay.
Hi.
Hello. I don't expect any magic answers, but I've been an insomniac for 44 years, since I was 18, and I'm now 62. I can't remember a night when I haven't had to have a tablet to go to sleep. When I was living in England, there was a lot of temazepam, and over here it's lots of alprazolam. They give me 1 milligram, and I tried to take half, and then I tried to take another quarter. I tried to take the minimum I can, but it's... Anyway, so that's been going on, and I don't expect any magic cure for that. I think that will be with me forever. But my first question is, are there any side effects for tablets for this length of time?
Yes.
And the second thing is that I have got a few things, like quite a lot of hair loss and stomach problems, and sometimes breathing as well. But I'm putting that down to a bit of a Malaga lifestyle, really.
Okay.
What's a Malaga lifestyle? That sounds intriguing.
I don't know. We've got a house out there. I've never got hair loss and difficulty breathing. What's going on?
Well, the hair loss is normally at the end of the summer. And
you're shedding?
Yeah, massive. And it happens every year, but it's worse this year. And I think in the summer, when your head's so hot all the time.
Oh, interesting.
Yeah.
Okay,
we have a hair cycle, so I just imagine.
Oh, we do, definitely, and people have different timings on them. Look, I hate to be the bearer of bad news, but long-term use of benzodiazepines, which is what you're doing, has a correlation with dementia. So it is something to bear in mind. And I know you said that it's been 44 years and I don't ever see that changing. Well, it will never change while you're taking those tablets. That's number one. And you may have to go cold turkey and come off them. Let me finish before you shout at me. Because I do know.
Sleep, don't worry.
I could almost write the book on not sleeping, because I never used to sleep either, and I used to always take a tablet. I now don't take anything. And if I have the odd bad night, I just chalk it down to the odd bad night. But they're not so common. But all sleep is psychological. And that's why you can't actually sleep now without your tablet, because you know that if you don't take one, you're not going to sleep. And it's a self-fulfilling prophecy that that's going to happen. There's a very good app called Sleepio that I send people to. I did it. It's brutal. You do 2 weeks where you log your sleep with them every night, but also your other habits like alcohol, things like that. And then they come up with a programme for you to follow for the next 2 weeks. The programme is brutal, but I guarantee that if you did that and without your benzodiazepines, you would sleep at the end of it. I guarantee it. It's really good.
Well, I'm still awake at 4 o'clock in the morning, and I think, I can't function well the next day unless I have some sleep. So in the end, I give in.
I know, but it's getting past that stage. It's really hard. I mean, melatonin.
Yeah, actually, I've been looking that up. Somebody gave me a few gummies. I tried one night, and to be honest, it didn't have a lot of effect. I don't know what the strength was, but I think I can have up to 10 milligrams.
You can. I take 3 milligrams. It's not going to do you any harm. It's supposed to be neuroprotective. When you're not sleeping, you won't produce melatonin, so it's a good reason to take it. You can't buy it in the UK, but you can buy it all over Europe, every corner shop in America, just not in the UK.
Where is that, by the way? Because I when I was in the States, I used to quite regularly use it for jet lag purposes, and to bring quantities of it back here for people. Why is Britain the only country you can't get melatonin?
Lord knows. I mean, we do prescribe it on the NHS.
But you can get it, Karen. That's the good thing. You can get it.
I'll bring some over for you if you like.
OK, you're on.
Market here.
I mean, you can get it in the UK. You just have to order it online from someone who ships it from Jersey.
OK, how ridiculous.
It's ridiculous. And we can prescribe it in the NHS for under 18s and over 65s.
Anyway, Karen, you're going to give that a go? I think you should probably confront it.
What was that?
Sleepio. Sleepio.com.
Okay. Sleep and IO at the end. Okay.
Yeah, have a look at that.
Good luck.
All the best, Karen. Thank you for the call. Karen in Malaga there. A lot of people have sleeping problems.
Oh, sleep's a big issue. It really is. And it is completely psychological, but it's quite hard for people to accept that.
Yeah, I'll tell you how I cured my insomnia. I got a job where I have to work about 17 and a half hours a day, and I find that really helps me nod off at night. Seriously, folks, let's go to Peterborough and talk to Robert. Hi, Robert. Talk to Dr. Renee.
Hi, Robert.
Hi. Good evening.
How can I help?
I've got a hiatus hernia, and I've been on omeprazole for the last 2 years.
Yeah.
And I've just seen a report where it's possibly linked to dementia. And I don't know if that's true or not, because it wasn't very specific.
Before you answer, can you tell me and the audience what a hiatus hernia is?
So a hiatus hernia, if you imagine this is your stomach and this is the ring at the top of your stomach, there's a bit of...
For those just listening, Renee's making lots of strange shapes with it, and now I'm doing it, but anyway.
It's where a bit of your stomach slips through that sphincter and goes up into your esophagus. It's sliding, it goes up into there.
Right.
And what it does is it allows acid to go back up into your esophagus and causes reflux and burning.
Okay.
Now, so omeprazole is a proton pump inhibitor. It actually cuts down your stomach acid. Lots of people are on these, and I, as you may know, Robert, if you watch any of my Instagrams over at Dr. Renee Hoenderkamp, I try and encourage people to come off these if they can. Your situation is slightly different. I'll explain why. Taking them for straightforward reflux, there are lots of lifestyle things that you can do for reflux. So you can cut out spicy food, you can get down to a good weight, you can stop alcohol and caffeine and chocolate, all the nice things in life, and then you don't have reflux anymore. Tomatoes.
Do all that.
However...
Tomatoes?
Yeah, tomatoes are a really direct irritant to the stomach.
Oh, that could explain a lot in my case.
However, a hiatus hernia is not quite so easy, because it doesn't matter if you do all of those things. You don't stop that bit of stomach slipping through the sphincter. So it's a bit harder for me to say that to you. Whether it's linked to dementia, those studies are very early and there are some confounders, but it is linked to bone health, and you can get fractures more easily, and later in life you have a lower threshold for pneumonia. They're not brilliant, but sometimes, although I'm completely anti-drug where we don't need them, sometimes you need them, and with a hiatus hernia you may need them unless you go for surgery, which is quite big.
Now there's an alternative, isn't there? I take omeprazole 2 in the morning, and I can never phanidamine, and that's a H2
inhibitor. Yeah. Isn't it something like famotidine?
Yeah, that's the one, famotidine. Yeah. Is that a better alternative?
Yeah. It's difficult. Everything has got side effects, but possibly yes. I think yeah.
Okay.
You could try it. They don't work as well.
Right. Yeah. Okay.
All right, Robert.
No, that's brilliant. No, thank you.
Thank you for the call, Robert. Look after yourself. Thank you very much, Robert in Peterborough there. Tell you what we'll do now. We'll go to a break, which will give us lots of time for 2 or 3 calls after the break. Rebecca in Cambridge, stay where you are. The doctor is waiting. Welcome back. I'm still with Dr. Renee Hoenderkamp. Call Dr. Renee with all your medical problems. 0344 499 1000. Let's go to Cambridge and talk to Rebecca. Now, Renee, Rebecca's 14-year-old daughter has an eating disorder, and it sounds like she's at the end of her tether. Rebecca, speak to Dr. Renee.
Hello, Rebecca.
Hi, I was wondering if you could help me. I and her dad have suspected it for a while. She's always been slim, but for the last year or so she's been really, really fatty with foods. And she is already under the CAMH teams.
Sorry, she was under what? Sorry.
She's under CAMS.
Yep.
Yeah. So today I got a call from one of her friends who was really concerned, and so I spoke to her after school. And yeah, it's a lot worse than I kind of thought it was. I thought that she was sort of just being a bit teenage, not vanity because that's the wrong word, but I thought she was just kind of conscious that she's in year 10 now, and she wants to look a certain way, and she's always struggled with sort of fitting in, and she now is. And then when I kind of drilled down to it, I realised she's kind of been living off of a fruit pot a day for about the last 6 months, and I had absolutely no idea. And so she takes sertraline already under those guys, and I just don't know what to do.
Okay. So
I'm really sorry.
So sertraline is an antidepressant. What was that prescribed for? Because very unusual we give children antidepressants.
So she has autism, but she's incredibly an anxious child, and she's never slept through the night. So they prescribed her that alongside melatonin.
Okay, all right. So is she under CAM's eating disorder unit?
No, she's under the psychiatry department.
So because where you live in Cambridge?
Yes.
Okay, so because in London, CAMS is a nightmare for us, so I don't know what it's like in Cambridge, but getting children accepted by them is quite hard. So do you know what her BMI is? Do you know what her weight is?
Yeah, so she's 5'6" and she weighs just under 5 stone.
Okay, so her BMI is going to be about 15. Okay, so she needs help and she needs it quickly. Does she accept that she needs help with this?
Today's the first time that she told me. I don't know if she told me because her friends had put her in a position where they were like, we're telling your mum.
Okay, what good friends. I like these friends.
Yeah, absolutely. I mean, that's huge for teenagers.
Right, why don't you, rather than... I mean, your GP can refer you into CAM's eating disorder unit, but it takes time. Is there any way you can speak to the psychologist or psychiatrist that you're under there to ask them if they can feed her into there to make it quicker?
I mean, yeah, I can. She sees that, and that's why one of the reasons I'm so shocked. They see her every week, and I'm like,
okay. So you need to have a word with them. Give them her weight, her BMI. So if you just go onto the NHS, you can do the NHS BMI calculator, and you can put it in imperial or in metric, and it will tell you exactly what it is. But I think it's going to be around 14, 15, which is obviously far too low. Unfortunately, anorexia, whilst still quite rare compared with other eating disorders, is probably the nastiest one that exists, and she needs specialist help quickly.
Yeah.
I'm so sorry, Rebecca.
I know. It's taken me.
I think you've got to get active though, Rebecca, right?
Really active. You need, and get her there ASAP. Speak to those psychologists. If they say no, that they can't do that referral, then get on the phone, emergency appointment to your GP tomorrow, and get that referral done. As I said, work out her BMI and everything so they've got all of the information they need, and plug her in.
All right, Rebecca.
Thank you very much for your help.
Well, good luck. All the best, Rebecca.
Take care.
It's terrible, isn't it?
It's a horrible disease.
Kids get that. Yeah.
Absolutely horrible disease. Don't see it as much anymore. Not anorexia, true anorexia. We see bulimia. Eating disorders.
Let me... you like this one? I'll just read this one. We should do a couple of the texts because people do take the trouble to write in. But you like this one. This is from Robbie. In Dublin, Dr. Renee is the most reassuring doctor I've ever come across in any format. She's so clear and confident in her approach. It makes even me feel better, and thank God I don't have any ailments at present.
Thank you, Robbie.
There you go. Check's in the post there. This is just a quick comment from you, really. I talk as someone else. This is from Karen in Taunton. I talk as someone else with fibromyalgia. It really annoys me when you hear GPs wanting to cut back pain medication because of addiction. They seem to think you're taking them for fun. Well, I don't think it is that, really. It is literally a worry of addiction.
Yeah, and it really is. And, there is lots of evidence to say that when you've been on medication for a long time, pain medication, it's not doing anything anyway. So they're probably just trying to see whether or not they can slim it down.
I've had that with coughs, and you get really bad coughs, and you go to the doctor, and the doctor said, well, we can't really give you antibiotics because, there's a worry that we might get superbugs. And it's like, look, I really don't want to take part in the big picture. I want some antibiotics.
I would say to you, I'm not giving you an antibiotic because it's not going to work on a viral cough, Kevin.
Well, it might not be viral. It might be a different kind of viral.
99% at the time it will be.
Oh, right. I'm not coming to see you then. I'll get them off the internet. No, that's a joke, folks. Don't do that. That's an unwise thing to do. Am I right?
Yes, of course you're right.
Yeah, seriously, too many people do that. It's a very bad thing to do.
People die doing that.
You don't know what you're getting. Don't get antibiotics from the internet. Right, quick one. This is from Mary in Kent. My God, you just made my day. This is to you by saying you take melatonin. My son is 17. He has autism. He's been on melatonin since he was 6. He takes 6 milligrams. Now they're refusing to give it to him because he's 17 and an adult, and they've asked him to go on sleeping tablets, which we don't want him to.
I'm absolutely flabbergasted at that. Oh, my goodness. I'm staggered by that because, firstly, melatonin is so much safer in the long term than sleeping tablets. Sleeping tablets are addictive. There are these risks of dementia and other things. I think put your foot down, say to your GP, just because their computer is saying to them they can't prescribe melatonin to an adult over 18, they can, because the GP can do what they damn well please. They don't have to follow that instruction from their local health board. And if they really won't do it, the website that I use for my melatonin is called biovea.com. They're a reputable company. You can order it online.
How do you spell that?
Biovea, BIOVEA.com. I am staggered by that. I spoke to a patient this afternoon who's got an autistic little girl, and sleep is a big problem for autistic kids.
Yep.
And she's only 3 and she's on melatonin.
Okay. Well, there you go, Mary. Biovea.com. Biovea.com. Get your melatonin yourself. Now, let's. We've got much time, but we've certainly got time to go to Scotland and talk to June. Hello, June. You've got problems with your knees. Talk to Dr. Renee.
Hello, June. How can I help?
Oh, hang on. Got more than problems with your knees. We've got problems. Can we hear you?
Psoriasis and. I think I have psoriatic arthritis, so I know I have. I've had 1 knee replacement. I'm covered in psoriasis. My nails are peeling off. I'm 56 years old. I used to be very active. The doctors don't seem to understand that I have psoriatic arthritis. Is there a test?
Yes. So
what's she saying?
So June's got psoriasis.
Oh, psoriasis.
And with psoriasis, you can get psoriatic arthritis. Okay. So they can X-ray your knee. Yeah. So they can X-ray your knee to see whether or not there are signs of joint destruction, which is what happens in psoriatic arthritis. Have you got a formal diagnosis of psoriasis?
No, I haven't, and that's what I'm looking for.
Okay.
Because my body is covered in psoriasis, as in the plaques.
Okay. So you need to see.
So you need to see.
Sure. So you need to see a dermatologist. So you need to ask your GP to refer you to a dermatologist to get that diagnosis. And because that's going to take a while, in the interim, your GP can very easily order you an X-ray of your knee to make sure you haven't got any joint destruction.
Yeah, I have. I've had all the X-rays and everything, but is there a test for psoriatic arthritis?
No, there's no test. It would be a diagnosis of psoriasis and then, arthritis that goes along with it, and then looking at seeing what's happening within your joints. So you need that diagnosis. You need to go to dermatology, because if you have a diagnosis of psoriasis, there are lots of treatments that they can employ, and if you've then got arthritis that goes with it, there are some very good treatments which can actually keep that at bay. Some of them involve immune suppressors, the MABs, things like that.
Okay, no, that's lovely. Thanks very much.
All right, Joan, look after yourself, June. Thank you for the call. Very quickly, Chris in London. Chris, if you could be as quick as you can, we've only got a couple of minutes, but talk to Dr. Renee.
Hello, Chris.
Yeah, Kev, we normally have a political row, but we won't do that.
All right, mate, yeah, let's deal with your medical problems tonight now.
Renee, I talked to you on a Saturday morning with David. Listen, I've got, cut it short, I've got peripheral neuralgia.
Yeah.
I've had both wrists done with the carpal tunnel. I've still got a little bit of pins and needles in them. They're still not perfect, but I don't have pain.
Right.
But my feet, it feels like I'm walking on Brighton Beach on the pebbles every day. It feels like I'm walking on rocks. And also, the thing that's worrying me is it's spread up my left leg, and my left thigh muscle now goes completely dead.
OK, so I would actually start at your lower back. I would get an MRI of your lower back and see what's going on there and see if that's what's causing the problem down your legs. Even though you think it's spreading up, it may still be your back. That would be my start point.
I think you've got to go and do that, Chris. Do that. Call me any old time, but we've got to go now because the show's nearly over. All the best, mate. That's Chris in London. I know about that. That's called referred pain, isn't it? I had that kind of thing coming down from my back.
Sciatic nerve.
Yeah, all my legs felt completely numb some years ago, but I recovered from that one, but I haven't recovered from all my other many mental problems. Listen, Renee, fantastic.